What's up, guys? Thank you for watching another video, and if you are new, welcome. My name is Nurse Kay. I'm a registered nurse that works in the ER, and my last video I will put right here in this little box over here so you can know, so you can go check a look so you can go take a look at that next. I made this channel that has everything to do with nursing, and if that is you in any way, shape, or form, subscribe down below, comment, like, help me get to 1K subscribers. Let's get started. So, you want to be an ER nurse, huh? Well, let's just talk about some tips to survive as an ER nurse. 4 tips of survival. Are you tuned in? Do you have your snacks, your water, your Coke, and your popcorn? In the ER, every day is completely different. One day you may have, I'm sick, I've been throwing up for 5 days. Next day you might have, I'm having chest pain, I think it's a heart attack. The next day, I'm really honestly just here for a doctor's note. Tip number 1, I would say, is learn as much as you possibly can. Do not put a cap on your learning. You will continue to learn, and it's important and imperative as an ER nurse to take care of critical patients. When you're doing the ER, whether you've been a med-surg nurse for years or you're a new grad, it does not matter. You're going to get the patients that are the most stable. Once you get your patient settled, you have nothing going on, go look at those patients that are a little bit more critical. Go help with the stroke patients, the heart attack patients, the trauma activation. The only way that you're gonna learn to get more comfortable and familiarize yourself with what goes on with those patients. Tip number 2, do not be afraid to ask questions. You must ask as many questions as your little burning little heart desires. Ask questions, ask questions. If you don't know what you're doing, ask. If you don't know what this medication is, ask. If you don't know the dosage amount you're supposed to give this patient, ask, because that's the only way you're gonna learn. You're not comfortable with something, it's imperative to make sure that you get comfortable. Please. Tip number 3, prioritize your patients. Prioritization, 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 prioritization. Do I have to say it again? You have to prioritize your most critical patients. And let me tell you, sometimes your prioritization is not in line with the doctor. You take care of your most critical patient. You get a full section. You need to figure out which one, based on vital signs, based on what they look like, based on their chief complaint. You need to figure out which patient is the most critical, and you need to take care of that patient first. I don't care if the doctor's asking you for something, for an aspirin for a stable patient. It's important that you stay in line with what your plan is. And your plan should always be, who will dial me first? Do not leave that room if the patient's blood pressure is like 60/40. Do not leave that room if that heart rate is in the 30s. Vital signs like that you need to pay attention to and prioritize your care. You're gonna get backlash for it, but as long as you know what you're doing and you're prioritizing correctly, everything will be okay and no one will die on you. Tip number 4, and the most important tip of them all, time management. Say it with me, time management. One more time.
Time management.
ER is just like a rat race. It's like continuous. It's like going and going and going. I don't care if you're drowning with all your other patients, you're gonna hit another patient. I don't care what's going on. You need to stay up to par. You need to make sure that you're starting your IV, getting your medications, getting that urine sample, and charting everything within a short amount of time. You don't want to spend 30+ minutes taking care of one patient. Yes, sometimes it happens and sometimes it's out of your control. And if you know you can't get that IV, you've already tried twice, don't waste your time anymore. Ask somebody else for help. Ask for help. The beauty about ER is that there is teamwork. Teamwork makes the dream work. That is like the heart of what ER is. Always be vocal, communicate with your team member. If you're drowning, don't drown in silence. And you see other nurses that are not drowning, sitting at the nurse station laughing and joking while you're sitting there 20 feet deep in the ocean. But they don't know it because you're not saying anything. And time management is definitely gonna come with time, but you're knowing kind of a little bit more of what to expect. If somebody's coming in with abdominal pain, they're nausea, vomiting, you're gonna need an IV. If somebody's coming in with chest pain, you're gonna need an EKG. Go ahead and just grab that. Be thinking ahead of the game and you will stay on track. That is the survival kit wrapped in a little bow for survival in the ER. I hope this helped you out. I hope that there are many future ER nurses watching this video. Don't forget to comment, like, and subscribe. Help me get to 1K subscribers, guys. Until next time, peace.